Hello there, it's Luke, and in this tutorial we're going to be considering the effects of anaphylaxis on our airway and breathing, and the sort of physiological changes that occur mainly due to release of histamine that bring about those changes. Okay, excuse me, there we go. Right, so a quick recap as ever. You'll see that when antibody, so an immunoglobulin E, is bound with a specific antigen, whether that's a drug or a food or some pollen, those two things together will then bind with a receptor on what we call a mast cell, and the mast cell will release its contents, and that contents is a whole bunch of inflammatory mediators. And the principal one that we're interested in this tutorial is histamine. And again, to recap, there are histamine receptors throughout, mainly smooth muscle throughout the body, and so this will mean that there are many symptoms affecting many different organ systems that you can experience during an allergic and anaphylactic reaction. So again, to recap, you'll recall that capillaries are permeable to water, but not ordinarily due to sort of many proteins, and in the presence of histamine, the epithelial cells that make up the walls of the capillaries contract, they get a bit smaller, and so the gaps between the epithelial cells get a little bit larger, and this will encourage fluid to leave the intravascular space, so to leave the capillaries and enter into the interstitial space. So that's the sort of fluid that surrounds the cells, sort of in the tissues, and there is much more fluid that sort of leaves the capillaries than is then reabsorbed by sort of osmosis and that oncotic pressure that's provided by the proteins within the blood vessels. And the sort of manifestation of that can be edema, and specifically when we're talking about an allergic reaction, we talk about something called angioedema, and this can affect many of the soft tissues, and it can be quite sort of striking. So this young child unfortunately has a lot of edema in their soft tissues around their eyes. Similarly, it can affect the soft tissues of the lips and the mouth and the tongue, and you can end up with these sort of very swollen features. Unfortunately, that edema can occur almost along any of the sort of soft tissue areas of the sort of respiratory tract. And what I'm about to show you now is the view sort of through someone's oropharynx. So this, if you've ever looked using a laryngoscope, then somewhere's larynx, you will recognise that here we have the vocal cords, okay, and above here, you just can't, it's not quite on this picture, is the epiglottis that sort of closes over when you swallow and things like that, and you'll just make out these sort of rings here, which are the sort of rings that go around the trachea. So essentially down here leads to your lungs. Okay, now this one on the left hand side is a healthy set of vocal cords, and on the right hand side I'd sort of ignore the colour so much, but you can see that the vocal cords in particular are very swollen, and all these sort of structures are very swollen, and so this gap here that would lead down to the lungs is massively reduced, and in fact we've got sort of airway obstruction there. Now this type of airway obstruction would lead to a symptom we might recognise as stridor, which is a very harsh inspiratory wheeze. It's a sound a bit like I'm sorry about that, it's a terrible impression, but once you've heard stridor in clinical practice, it sounds a bit like that, and you'll never forget it. It's an emergency. Okay, now we're going to move away from the airways themselves and get down into the sort of lung parenchyma, into the sort of around the sort of alveoli themselves, and we're going to look here at consider the Starling forces that we referred to earlier on, so the hydrostatic pressure within a blood vessel that encourages fluid to leave the capillary and enter the sort of fluid in the surrounding tissues, and that is balanced very keenly in your pulmonary circulation by the oncotic pressure exerted by the proteins within the blood vessels drawing the fluid back in, and you've got this sort of almost equal amount of fluid leaving and re-entering. Now, when in the presence of histamine, which again forces those epithelial cells to contract, and so the spaces between them get larger, and in doing so, the blood vessel, the capillary, becomes very permeable and starts leaking out more fluid, an excess of fluid into the lung tissue. And anybody that's familiar with looking at chest x-rays and has seen one that suggests pulmonary edema, which is when the fluid leaks into the tissues of the lung itself, this will be a familiar sight. However, for those of you that may not, we've got a couple of sort of ECG dots here. This area here towards the bottom of this right lung field, and certainly across here on the left, is very kind of hazy and a lot more white than you would expect for it to be, and that is one of the signs that might suggest pulmonary edema. That's why that slide's in there. Now, the issue with pulmonary edema is that it increases the distance that oxygen in particular has got to travel from within the air sacs, within the alveoli, to get sort of through that additional fluid and then into the capillaries and the blood vessels, where it can then join with hemoglobin and travel around the body. So where the sort of transfer of oxygen from the gas in the alveoli into the bloodstream is impaired, this would then lead to hypoxia, which is a technical term for sort of low blood oxygen. Okay, and again with pulmonary edema, you might expect the patient to experience difficulties breathing, so dyspnea, cyanosis, which is a very late sign of hypoxia, so they begin to go blue because those hemoglobin, those red blood cells aren't carrying very much oxygen, and again you might hear probably an expiratory wheeze as the person tries to sort of breathe out, and they have all this sort of fluid within the lung tissue. Now, another effect that can occur and impacts on lung function and somebody's breathing is that the bronchioles, so if we look on this diagram, we've got the trachea, the left and right main bronchus, and these sort of branch down into sort of different sizes of bronchus until we get to these sort of smaller airways called bronchioles, and they have a smooth muscle layer themselves, not dissimilar to blood vessels. And here is a sort of cross section, if you like, through a terminal bronchiole. So right at the kind of end of your airway, just before it reaches the alveoli. And so here we have the kind of lumen of the bronchiole, and surrounding it there's a layer of smooth muscle tissue there, and these sort of little pockets here and there that you can see are the sort of alveoli themselves. And similar to blood vessels, the smooth muscle within the bronchioles is kept under tone, so there's a little bit of contraction there all the time to keep it just the right degree of sort of flow of air moving through into the alveoli and back out again. Now, unfortunately, in the presence of the mediators that are released by the mast cell, histamine and also leukotrienes, these smooth muscle cells are stimulated to contract, and what happens in the bronchioles is that you get something called bronchoconstriction. So the lumen, the sort of hole through which the air should travel, gets smaller, and as you can imagine, that increases resistance to the flow of air, making it more difficult to breathe in, but actually breathing out is extremely difficult as well. And you may be familiar that bronchoconstriction is one of the main pathophysiological changes that occurs in asthma. Well, it's a very similar sort of process that occurs in anaphylaxis as well. Now, similar to an asthma attack, the person experiencing bronchoconstriction during an allergic reaction may wheeze, and it'll certainly be a very distressing situation for that person. So, in summary, we're aware that anaphylaxis can be a life-threatening event. Not only can it affect your circulatory, your cardiovascular system, but it can affect your airway and your breathing as well. And this occurs via two mechanisms. So histamine can cause the capillary blood vessels to become very porous, very permeable to water, and you can get edema formation within the tissues, which you may see as angioedema, or edema within the airway itself, which can cause obstruction. And also histamine and leukotrienes especially can cause bronchoconstriction, which is a narrowing of the airways into the lungs, which inhibit the flow of air through the lungs. Thank you very much for listening to the session.